Misophonia, or hatred of sound, is a neurological condition characterized by an intense emotional reaction to everyday sounds such as the sound of eating, typing on a keyboard, or coughing. People with misophonia experience strong negative emotions when they hear these sounds. These reactions can range from mild annoyance to intense rage or fear and panic. Those who suffer from this condition often experience social isolation due to their inability to cope in settings with loud noises or conversations. Unlike other forms of hearing difficulties, people who have misophonia do not have difficulty hearing sounds. If anything, they hear sound more intensely. It is likely a neurological condition, but their reaction to sounds occurs on an emotional level. Although it can be difficult for those living with misophonia to cope in everyday situations, there are misophonia treatments available which can help manage symptoms and improve quality of life for sufferers. Misophonia test. Might you have misophonia? Here is an unofficial misophonia test. Please note that this is for informational purpose only, not a diagnostic tool. My life is affected by my problems with sounds in the world. My difficulty tolerating certain noises makes me not want to leave the house. I am bothered by the sounds of people eating or chewing. When I sit next to my intimate partner, the sounds they make, breathing, fidgeting, coughing, bother me. I hate it when people clear their throats or snort. I get fixated on it and cannot relax. I hate seeing repetitive movements in people, for example when they click a pen, tap their finger, or wiggle their legs. I can only work in silence. Even the sound of a fan or refrigerator disturbs me. Even sounds from nature, such as barking, wind, leaves and trees disturb me. It is difficult to live with someone because everyday noises, such as walking or typing on a computer, bother me and I cannot concentrate. I am annoyed when people speak with a particular intonation. I have to have a silent clock. I cannot be in the same room with a clicking clock. I feel like no one really understands that I have a problem with noise and they think I am being dramatic. I panic when I know I am going to be in a room with sounds I hate. I have a hard time working in an open office because of my sensitivity. I am afraid that there is something wrong with me. I alienate myself socially to find more peace of mind. I feel guilty because I get annoyed by the sounds my friends and housemates make, even though I do like them as people. I feel enraged just thinking how selfish some people are as they are not aware of the noise they make. I feel compelled to ask people to stop making certain sounds, e.g. clicking a pen, but I don't feel assertive enough to do so. I feel extremely alone in the world because no one understands what I am struggling with. I have tried everything from earplugs to noise-cancelling headphones, but with little success. Sometimes I wonder if I really love my partner, because sometimes I do not want to be in close proximity with them. I have tried to seek help, but the conventional doctors do not understand my struggles. I feel defective as a person, and I worry my issues are not legitimately medical. If you identify with more than 6 to 8 items above, it is worth looking into an official misophonia test or assessment to see if you can get a diagnosis. Hypersensitivity and misophonia. Misophonia is a neuro-otological diagnosis in which certain auditory stimuli are being interpreted by the brain as threats. The condition was established in 2001 by American otolaryngologists Pavel and Margaret Jastroboff. They observed that some people reacted to sounds such as chewing, keyboard typing and coughing with high levels of irritability, elevated heartbeat, muscle tension and sweating, along with other stress responses and strong negative emotions. Although the exact cause of misophonia is not yet known, there are several theories about it. Some suggest that it may be related to hypersensitivity of the central nervous system or overactivation of certain brain regions in response to auditory stimuli. Hypermirroring and misophonia. Interestingly, some recent research has found a link between having a hypersensitive and highly activated mirror neuron system and misophonia. The mirror neuron system, MNS, is a neurological system that consists of neurons that are believed to enable the ability for humans and other animals to recognize, understand, and empathize with the actions of others. This is also the mechanism behind emotional empathy. It makes sense, therefore, to draw a potential link between hyperempathy as a trait and misophonia. Many people with borderline personality disorder have been found to have a highly active mirror neuron system, which makes them more prone to emotional contagion and be affected by other people's feelings, especially negative ones. It wouldn't be surprising, therefore, to say people misophonia is common in highly sensitive people, in the gifted, and in people who are hyper-empathic. People who are diagnosed by borderline personality disorder may also be more prone to suffering from misophonia. Other theories suggest that psychological factors, such as negative experiences with noise in childhood, trauma, or even a genetic predisposition, may be the cause. Misophonia treatment, from conventional to alternative. When it comes to treating misophonia, there is no magic formula. One of the most common forms of treatment that doctors prescribe for misophonia is cognitive behavioral therapy, CBT. Cognitive behavioral therapy helps sufferers understand their reactions to certain sounds and learns how to better manage those reactions. In addition, medications such as selective serotonin reuptake inhibitors, SSRIs, can be used to reduce anxiety symptoms associated with misophonia. Other therapies include sound therapy, music therapy, and lifestyle changes such as avoiding trigger sounds or using noise-cancelling earplugs or headphones if needed. Not everyone finds the above measures helpful. Another alternative treatment is tinnitus retraining therapy, TRT. Tinnitus retraining therapy was developed in the 1990s to address a common problem associated with misophonia, tinnitus. Tinnitus is a hearing disorder characterized by persistent ringing or other sounds in the ears. TRT works with a combination of cognitive behavioral therapy and sound therapy to reduce the emotional response to the tinnitus, improving the patient's ability to cope with their symptoms. TRT combines counseling and sound therapy to retrain the brain so that the person can better cope with their condition. The steps of this treatment are simple, but they require consistency and commitment to be successful. Another option for treating misophonia symptoms is mindfulness and meditation techniques, such as mindfulness-based stress reduction, MBSR. Misophonia treatment versus hyperacusis treatment. Hyperacusis is a condition that comes from a difficulty in the way the brain's central auditory processing center perceives noises. Individuals with hyperacusis have difficulty tolerating sounds that do not seem loud to others, such as the noise from the dishwasher, fan on the refrigerator, or shuffling papers. Such sensitivity to the most ambient noise can have a huge impact on the person's day-to-day activities. Hyperacusis may be a result of injury or trauma and can develop gradually over time. Conditions associated with hyperacusis include post-traumatic stress disorder, chronic fatigue syndrome, epilepsy, tinnitus, migraine headaches, and depression. Currently, there are no specific corrective surgical or medical treatments for hyperacusis. However, sound therapy may retrain the auditory processing center of the brain to accept everyday sounds. This works on the basis of neuroplasticity. Hyperacusis and misophonia are different conditions. Unlike people with hyperacusis, individuals with misophonia respond particularly strongly to repetitive and pattern-based sounds. In hyperacusis, the response to the sound was felt as physical pain in the ear canal. In misophonia, the reactions were more emotional, involving fear, panic, and irritability, and go alongside other physical stress reactions, such as racing heart and tight chest, but dissipate when the noise goes away. In hyperacusis, the louder the noise, the greater the pain, while in misophonia, it was not the loudness that constitute the reactions. Regardless of the sound's loudness and frequency, the emotional response and whole body contraction are instantaneous. However, the treatment proposal for misophonia and hyperacusis often overlap. Misophonia treatment and understanding within a neurodiversity paradigm. The neurodiversity paradigm may help to explain misophonia. People's brains differ. Some people are born with a biochemical or neurological makeup that makes them more emotionally or intellectually intense, sensitive, and susceptible to external stimuli than the general population. Many people feel as if they're shooting in the dark when it comes to seeking misophonia treatment because conventional doctors misunderstand them or conventional medicine does not help them. Understanding of mental health and health is frequently limited to categorizing people based on a disorder or diagnosis. A part of an effective misophonia treatment protocol would include reframing the meaning of having misophonia. The neurodiversity paradigm proposes that the diversity embedded within us, while difficult to navigate at times, makes us stronger as a species, as communities, and as individuals. Having a group of people who function more intensely in the world is not only a natural form of human diversity, but it's also an important factor in our evolution and the advancement of our collective consciousness. This viewpoint contradicts the medical model, which holds that there is a normal and desirable way of functioning and that the rest are disorders. Understanding individual differences within a neurodiversity paradigm can be invaluable in that they can help you make sense of your life history. Taking a strength-based postmodernist misophonia treatment approach encourages you to look at your condition from a new perspective and view it as an opportunity for personal growth instead of a hindrance. This may include practically understanding more about what misophonia is and how it affects day-to-day life. Practicing self-compassion may also help you move beyond feelings of helplessness or frustration when encountering triggering noises. Thin skin versus thick skin. Understanding the concept of having thin skin may help us understand misophonia. Thin skin versus thick skin comes from the boundaries in the mind concept developed by Ernest Hartman. Boundaries in the mind is a concept that characterizes the way a person operates in the world, particularly how that person handles energies and feels the tone of his or her surroundings. To what extent are stimuli let in or kept out? How are a person's feelings processed internally? Quoting Hartman, "There are people who strike us as very solid and well organized. They keep everything in its place. They are well defended. They seem rigid, even armored. We sometimes speak of them as thick-skinned." At the other extreme are people who are especially sensitive, open, or vulnerable. In their minds, things are relatively fluid. Such people have particularly thin boundaries. The colloquial term having thin skin may have a scientific basis. Since its discovery in the 1980s, at least 5,000 people have taken Hartman's boundary questionnaire and more than 100 published papers have referenced it. Research is mounting to build a picture of issues and symptoms that are associated with the thickness of mind boundaries. Having thin skin or having thin boundaries not only means you may have misophonia, but it also means that globally you are highly sensitive and may demonstrate the following from an early age: reacting more strongly to sensory stimuli and becoming agitated due to bright lights, loud sounds, particular aromas, tastes, or textures; responding more strongly to physical and emotional pain in themselves as well as in others; becoming stressed or fatigued due to an overload of sensory or emotional input; be more allergic and have immune symptoms that are more reactive; be more deeply affected by events during childhood. People with thick skin, in contrast, may have the tendency to brush aside upsetting emotions in order to solve the problem at hand or to get practical matters in order, have less apparent mood swings, are slower to recognize how and what they are feeling, less sensitive to subtle changes or nuances in their environment, may experience an ongoing sense of detachment and sometimes emptiness. It is worth pointing out that people with thick boundaries are affected by feelings as much as people with thin boundaries. In experiments, this was indicated by bodily signals such as heart rates, blood pressure, hand temperature, and tension. Interestingly, significantly thinner boundaries were found in the following population: art students, music students, mixed groups of creative persons, frequent dream recallers, adults and adolescents with nightmares, male and female fashion models, persons with unusual mystical experiences, persons with a diagnosis of borderline personality disorder, schizoid personality disorder, or schizotypal personality disorder. On the other hand, groups that score significantly thicker on the inventories include naval officers, salespersons, lawyers, persons with a diagnosis of obsessive-compulsive personality disorder, persons suffering from alexithymia, patients with a diagnosis of sleep apnea. Having thin skin may have implications beyond psychology. The concept of mind boundaries is unique in that it also ties in with an impact on physical health, which is where misophonia might come in. It was found that thick boundary people are more prone to hypertension, chronic fatigue syndrome, and ulcers, whereas thin boundary people are more susceptible to migraine, irritable bowel syndrome, and allergies. There also appears to be a relationship between thin boundaries and multiple chemical sensitivities. In their work Your Emotional Type, Dr. M. Joyer and M. Makosi pointed out that being aware of your emotional type, where you are on the mind boundary spectrum, would allow you to access the kind of support that is more likely to benefit you. This applies too when you are seeking misophonia treatment that is right for you. Misophonia treatment. Healing Thin Energetic Boundaries. In their seminal work, Healing Developmental Trauma, Heller and Lapierre discuss the idea of energetic boundaries and how these boundaries can be compromised. People with misophonia are also more likely to have thinner energetic boundaries, so a misophonia treatment protocol can also be informed by how we can heal and resume more intact boundaries. Our energetic boundaries constitute the three-dimensional space that is above us, below us, and around us. It buffers us and regulates our interaction with other people and the environment. We are all to some degree aware of the impact of a compromised physical body. Try imagining someone standing too close to you in public transport. However, unlike physical boundaries, energetic boundaries are invisible. Thus, the experience of a boundary rupture can be puzzling and distressing. For instance, you may not be able to recognize clearly when and how your energetic boundaries are being violated. People with intact energetic boundaries are able to have an internalized sense of safety and a capacity to set appropriate limits with others and the world around them. However, where there is a chronic early threat, you may struggle to fully develop these energetic boundaries. If you were born sensitive, with thin skin, trauma will further weaken your energetic boundaries. With thin skin and ultra-thin energetic boundaries, you will physically become extremely sensitive to your surroundings. This phenomenon is also experienced by those who identify as empaths. Sometimes you can appear psychic and be able to energetically attune to others and the environment. On the flip side, you can feel swamped or invaded by other people's energies and emotions. Having thin skin or thin energetic boundaries can also lead to the feeling of spilling out into the environment, not knowing the difference between self and other, inner from outer experiences. The inability to filter external stimuli makes the world seem continuously threatening, leading to a constant state of tension and hypervigilance. As a result, you may feel the need to isolate yourself. As you don't have an adequate internal sense of safety and energetic boundaries to count on, you may have defaulted to using minimizing contact with other human beings in order to feel safe. Here are some of the questions drawn from a checklist developed by Heller and Lapierre on symptoms that may indicate difficulty with the connection with self and others due to early trauma. Do you suffer from environmental sensitivities or multiple allergies? Do you have migraines, chronic fatigue syndrome, irritable bowel syndrome, or fibromyalgia? Did you experience prenatal trauma, such as intrauterine surgeries, prematurity with incubation, or traumatic events during gestation? Were there complications at your birth? Have you had problems maintaining relationships? Do you have difficulty knowing what you're feeling? Are you particularly sensitive to cold? Do you often have the feeling that life is overwhelming and you don't have the energy to deal with it? Are you troubled by the persistent feeling that you don't belong? Are you always looking for the why of things? Are you uncomfortable in groups or social situations? Does the world seem like a dangerous place for you? Misophonia treatment. What to do from here? Misophonia is a kind of invisible disability. Having an invisible disability can be incredibly lonely. People with an invisible disability have no physical signs of the illness or impairment to alert those around them to what they are going through. It is often difficult for other people to understand, leaving those affected feeling isolated and lonely. Social interactions become challenging when you have misophonia. The feeling of being excluded from society can be exacerbated if you do not have access to support systems that would allow you to cope better and interact more confidently in a social setting. With misophonia, you may also experience stigma from your family members or peers who may think you're exaggerating your symptoms or using them as an excuse. Accepting any disability or condition can be incredibly difficult and emotionally overwhelming. Yet it can be liberating to have a name for what you have suffered from all your life and to know that you're not alone. It's important to try to accept the condition without fighting it. That way we can move forward with an action plan that maximizes our chances for better well-being and a good life. Being organized and prepared for triggers is of the utmost importance. This includes changing your environment, such as using noise-cancelling headphones or reducing the amount of time you spend in noisy environments. Make sure you're always prepared. Take earplugs and headphones with you when you go out, and take it as seriously as a diabetic needs insulin. Personally, I have found noise-cancelling headphones to be very useful. My favourite brand is Bose. In the noisiest environments, I pair them with a white noise app or a white noise video on YouTube to help me cope with the noise. Misophonia is a condition that can be difficult to explain and understand. Your family may not fully understand misophonia, but it is worth talking to them, showing them official documents or sources that show what you are going through. Even if they cannot do anything to help you directly, their understanding can make you feel more supported. As much as possible, let them know that this is a neurological condition and not a conscious decision. You are not intentionally trying to be difficult. As it is not a choice, there is also no need to feel guilty or ashamed for honouring your needs. If you need a quiet space to work or downtime to recuperate from the noise of the world, it is within your right to do that. You are not hurting anyone. You may find that you cannot help but feel that there is something wrong with me. One of the best ways to cope with shame is through self-compassion. Take time for yourself, speaking kindly to yourself, and being mindful of your feelings can help you stay connected with your emotions without getting overwhelmed by them. Would you judge your own child or a friend harshly for their disability? Probably not. Can you extend that kindness to yourself? Another important way to handle shame attacks is through connection and communication with those around you. Talking openly about what makes us feel ashamed can counterintuitively take away some of the power that shame has over us. It can be incredibly difficult for people with misophonia to work in an environment where they're constantly surrounded by noises that trigger negative reactions. Having an open conversation with your boss about misophonia can be beneficial for both sides. They will have a better understanding of your needs and what accommodations may need to be made in order to ensure a productive workplace. You may feel more comfortable discussing strategies that can help and wouldn't affect others, such as noise-cancelling headphones or moving desks away from noisy areas in the office. Even if your boss does not really understand what misophonia is, that doesn't mean they cannot make reasonable adaptations for you. When necessary, you can also speak to human resources about your right to reasonable adaptations. Each person is different. You may have to experiment with different things to find what works best for you. Most importantly, please remember that just because you have misophonia does not mean there is something inherently wrong with you. Having certain sensitivities or needs is completely normal and should be embraced as part of who you are. It makes you unique and may even help you to be a stronger, more assertive person who stands up for their rights. No one should ever feel ashamed or embarrassed because their needs differ from others around them. Instead, recognize yourself for all of your qualities, even when some of them are a little more inconvenient.